In the greatest name of Almighty Allah, who is Rahman and Rahim, welcome back to the Dr. Najam lectures. In this video, we will perform the examination of patient, palpation of the lymph nodes, palpation of the spleen, liver, and the pathological masses. First of all, we will start palpation of the lymph nodes, which are the clinical relevant. There are the three important manifestations of the lymph nodes. First is basically on the head and neck area, and second is basically axilla region or the axilla area, and third one is basically known as the inguinal area. Lymph nodes are usually examined from cranial to the caudal. About one third of the lymph nodes are usually lie in the head and neck area, where they lie superficially. That's why they are easily palpable in that side. Techniques for the palpation. First of all, we have to palpate each lymph node clearly. To differentiate the lymph node from the muscle, we have to notice that examined area should be fully relaxed. Through this way, we can differentiate the lymph node from the muscle. And while palpating the lymph node, if the lymph node is enlarged or inflamed, we have to notice few points. Number one is basically the consistency. The lymph node is basically soft, firm, or the hard. And also we have to notice the tenderness, like lymph node with the pain or the painless. And also we have to notice the number, how much numbers are there in the group inflamed or single lymph node is inflamed. And also we have to notice for the erythema, if it is redness into the lymph node area. Now we palpate the lymph nodes which lies in the head and neck area. First one, we have the suboccipital lymph nodes, then retroauricular lymph nodes behind the ears, periauricular lymph nodes in front of ears, submandibular lymph nodes beneath the jawline, submental lymph nodes under the chin, also the lymph nodes along the posterior triangle of the neck. And also we have the lymph nodes along the internal jugular vein. We know very well that here is a presence of one muscle, that is the sternocleidomastoid muscle. The lymph node sometimes lies ventral side to this muscle and also the dorsal side to that muscle. We have to palpate this, then the dorsal side. Then we have the lymph nodes on the supraclavicular lymph nodes. They are the special lymph nodes because enlargement to this associated with the malignancy. Especially on the left side, we have the verrucous nodes. Enlargement to the supraclavicular lymph nodes on the left side may indicate the mastitis form, abdominal tumor like the gastric cancer. Now, the palpation of the axillary lymph nodes. First of all, we have to palpate the pectoral lymph nodes, which are the anterior lymph nodes which drains the chest. Then we have the subscapular lymph nodes, which are the posterior lymph nodes which drains the arm and the back. Then we have the brachial, which are the lateral lymph nodes which drains the arm. Then we have the central lymph nodes, and they are present at the base of the axilla. In the last, what we have the lymph node that is basically known as the subclavian lymph nodes. There is a single tip. Sometimes we have to keep arm relaxed and lower down during the exam. In the systematic palpation and the relaxed muscles, better detection of the infection, cancer, and the systematic diseases. Now, the palpation of the inguinal lymph nodes. For this, patient should lie down in supine position. So, inguinal lymph nodes are basically divided into the two groups. First one is the horizontal group, and second group is basically known as the vertical group. The horizontal group basically lies under the inguinal ligament and supplies the or drains to the external genitalia or the lower trunk. And second one, we have the vertical group, and vertical group lies along the saphenous vein and drains to the lower limb. So we will do the palpation like this. So this is the palpation of the horizontal group of the lymph nodes or the inguinal lymph nodes. And the second one, we have the vertical lymph nodes. Now, the palpation of the spleen. As we know very well that the spleen is basically the lymphoid organ. So while performing the palpation of the lymph nodes, we must have to palpate the spleen also. Spleen in normal adults, it is not palpable. But however, whenever it has the pathology or any infection, it can be palpable. So it can be palpable when it is enlarged into the left subcostal marginal area. So when it is enlarged, basically we have to palpate like this. There is a one tip, gently lift the left flank to help to bring the spleen closer to the palpation. Now the palpation of the liver. We start the palpation of the liver by asking a patient to exhale. As a patient inhale, slowly slide your fingers upward towards the rib cage, aiming to feel the liver edges. When we feel the lower border of the liver, we have to evaluate the surface, consistency and the size. If the liver is enlarged, we might extend our palpation from the more downside to the right lower quadrant. And in some patients, the belly is greater or the abdominal diameter is greater, we have to do the bimanual palpate, like palpation with our two hands. This was all about the palpation of the lymph nodes, palpation of the liver and the spleen. I hope that you like this video. Do subscribe to Dr. Najam Lectures.